Congratulations! You've had your baby, you're home from the hospital, everything was going great until now. Your breasts are hard, they're painful, it's hard for the baby to get latched on because there's nowhere for them to latch because your breast is a bowling ball. Today we're going to cover engorgement on how to fix it, why it happens, how to get it better, and some red flags to cover just in case it gets worse. Stay tuned. Here we go. You may have heard that engorgement is when your milk is coming in and it's just all this milk that your baby's just gonna love and eat it up. That's not true. That's a combination of lymph fluid and blood supply and your milk. And everything comes together in this big like traffic jam in those breasts. And your hormones say, oh, time to start milk. And your tissues go, what are we doing? And there's this confusion in your body that just causes a lot of swelling. And sometimes that swelling gets to the point where your breast gets so hard, your baby can't latch because there's no soft nipple to get to. So engorgement typically happens between days 3 and 4 postpartum. It can happen anytime between days 2 and day 6. And it comes on the later end after C-section because your body's more worried about itself and its own recovery than making milk early on. So keep that in mind. But typically it'll happen between days 3 and 4. And if we are very careful on management, it will only last 1 to 2 days. So if you can hang in there and get through this, and we can talk about how to get through it together, you'll feel much better quickly. Okay, so how can we manage this engorgement? How do we get through it? One of the best things, of course, to do is to feed your baby. How are you going to do that when your breast is so hard, your baby can't latch? This is what's called reverse pressure softening. Here I have my little Betty Boobie. Here's your areola. We want to push against that areola very gently and get around all sides of that nipple. That's going to push that milk from the areola back into the breast tissue, and it's going to soften that areola so that your baby can get an easier latch to that whole nipple rather than just going on the tip that they can find. So just very gently use both fingers, and sometimes it's easier to use both hands, and just go all the way around that nipple and try to get that milk back in that breast so it softens the areola so your baby can get a deeper latch. Number 2 is lymphatic drainage. This is my favorite thing because not all of that fullness in your breast is from milk. So we want to get some of that extra fluid out of there. That means I like to lay backwards on a bed, on the floor, anything horizontal. And you're going to do some gentle stroking of that breast towards the armpit, because the armpit is where you have your lymph nodes. We want to get just very gently. We don't want to deep massage. We don't want to hurt the tissue. We don't want to bring more inflammation to the area, but we want to just do nice gentle stroking towards the armpit. Go all the way around everywhere you need to, and just as it feels comfortable. The next thing to do is cold therapy. Cold therapy could mean an ice pack, no ice on the skin. Put an ice pack wrapped in a dish towel, put that on your breasts after feeding for 15 to 20 minutes, and just let that cold pressure help with the inflammation that's in there. That'll also help reduce some of the swelling. Cabbage leaves. I'm sure you've all heard the wives' tale of cabbage leaves. They actually work. You want to get those big green leafy cabbage leaves, the ones on the outside so they're bigger. Rinse them off, chill them, put them in your bra. Put them in your bra for the same thing with the cold pack, about 15 to 20 minutes. And just, when it gets wilted, throw it out. That should help too. We also want some ibuprofen. If you can take that, that'll help reduce the swelling as well in your breasts to allow that milk to flow a little bit easier. Also, proper fitting bra. We want a bra that's not going to be too restrictive because we don't want to restrict the milk from coming into those breasts. We also don't want it too loose to let more and more of that fluid that's not supposed to be in there happen. We don't want any underwire. Underwire can help clog those ducts that might be coming in and can be more uncomfortable. We also want loose fitting clothes. So a shirt that's not going to be too restrictive and you're going to have more freedom to move without that pressure against those breasts. Frequent feeding is the number one thing to do. Like we talked about with reverse pressure softening, the more we can get that baby on the breast to help relieve some of that milk pressure, the better. Your baby's probably going to be cluster feeding anyway, because once they can taste that milk coming in, they're going to be like barracudas and they're going to feed and feed and feed. If you can feed your baby every hour and a half to 3 hours max during this period, your baby's going to help take that pressure off as well, naturally. And you're going to help that milk to come in so that as that fluid shifts out, the milk can then step in and you're gonna have a better supply. So those are the top tips to get through this phase. Okay, what do we avoid? If we're gonna do all those great things to help reduce that swelling and inflammation, how do we avoid it? Well, number one is massage. We don't wanna do deep massage in that tissue. The more you push and push and push, the more that fluid just wants to keep making that inflammation worse. And so doing your best to avoid the deep massage, and people will tell you, oh, massage, 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 get that milk out. Gentle is okay, but we do not want anything deep, anything traumatic to that tissue. I would avoid it in general unless you're going to do that gentle stroking towards the lymph nodes. Now, avoiding heat at all costs. They used to say heat before feed, that let that milk come a little bit easier. Heat brings inflammation, and that's not what we wanted this time. Maybe later when you're dealing with other issues, but not right now. Also, like we talked about, the tight fitting clothes. We don't want to restrict anything. We don't want to make you feel more uncomfortable or restrict the milk from coming in. Also, try not to completely empty your breasts. We don't want to get out the pump and pump in addition to feeding your baby, because that, again, that signals your body to just make more and more milk, and then we can run into an oversupply issue, which we don't want. Engorgement is one thing, and that can lead to oversupply if we are doing our very best to drain and drain and drain, trying to get that pressure to go away. Because again, it's not all milk, but if we keep taking more and more milk out, your body says, oh, we need more and more milk to come in too. So be very careful that you're not over pumping in addition to feeding your baby, because we don't want to start that cycle. All right, what are the red flags? What are we watching for to make sure that this doesn't progress into something worse like mastitis? Number one thing to watch for, red streaks from that breast, especially if it's only on one side. Those red streaks are obvious signs of inflammation and can be a sign of infection. So being very aware and being cognizant of what your breasts are doing, what they should feel like, what they do look like in the mirror, and if there's any hot, hard, red areas that doesn't improve with feeding your baby, watch on it, make sure it doesn't get worse. If it does get worse, you're seeing your OB. If you feel like you have the flu, any flu-like symptoms, especially with a fever, that's a number one sign to go call your OB and see if you need an antibiotic for mastitis. If you feel like your baby is unable to get a latch after 2 to 3 attempts, and that baby, despite reverse pressure softening and making sure your baby is awake, nothing's working, go see a lactation consultant to make sure that baby can get food, supplement as you need to, but we need to make sure that that latch is protected and your breastfeeding journey is on a good start. Remember that anytime you're stressed, and engorgement can be stressful, if you're stressed, in pain, and frustrated, your baby can feel that. They're very intuitive creatures, and they know if you're stressed, they will feel stressed too. So when you're getting overwhelmed, have a deep breath, pass your baby off, get everyone calmed down, and then try again with the breastfeeding. If your breastfeeding is feeling stressful, your baby's not going to want to go to the eating phase, because they're going to be stressed as well, thinking it's fight or flight, not rest and digest. So keep that in mind. Try to keep an even head, relax, deep breath. You're going to get through it. So be patient with yourself and with your baby and with your breastfeeding journey. Every day will get you closer and closer to your goal. Okay, I think that's about everything you need to know about engorgement. If you have questions or concerns, please drop them in the comments below. If you have any suggestions, again, do the same thing. If you like this video and you want more of them, please comment, and I will see you on the next one.